Hello and welcome to the town meeting program for the 18th of May. It's Monday. We're glad to have you with us. We're glad to have Cordova Wireless Communications as the sponsor of the show here. Your local cell phone provider that provides your local talk show on demand, available by request, I would add. Been a lot busier in the last few months than it's been over the last few years, for obvious reasons, of course. And today we are going to mostly look at the special council meeting coming up at noon, which will be broadcast on the city's YouTube channel. Before we do that, we'll kind of get caught up and hear what our mayor had to say and our governor had to say at the end of last week. And then depending on how we're doing on time, we might be able to move on to some other things, including a recommendation from the state to carefully and with calculation consider expanding your social circle to find a better balance between staying safe and isolated from one another to avoid spreading the disease around, but also that important mental health and, some would say health for the soul of being able to spend time with at least a few key people in your life in physical proximity. So we'll get into that a little bit later. First, though, we will, let's start with the governor. Here is how the governor ended last week. This is from the Friday press conference, kind of stating where he feels things are and where they should be headed.
This virus is going to be with us for a while. Vaccinations are a year to year and a half off at best, from what we understand. Antivirals will come sooner, which will help treat the individual once they contract the virus. And we're learning more and more about the virus. Again, we talked about earlier about how the earlier models, it looked pretty grim. And those models didn't pan out, which is great news. We have to look at all aspects of health in a society: mental health, emotional health, physical health, financial health, economic health, other social healths. They all contribute to overall well-being and health of a society. We did what we thought we needed to do based upon the models. We kept our numbers lower than any other state in the country, generally speaking. We are, I think, in a unique position going forward. We have an opportunity, and we did. We opened up our businesses 3 weeks ago. No dramatic increase in cases. We need to get to the point in Alaska where we don't fear the virus, we understand it, and we respect it, especially if we're in one of those categories in which if you contract the virus, it could be problematic. But for many of us, we need to manage the virus. We're going to stop we're going to get out of the mode of letting the virus manage us. We're going to manage the virus. We're going to incorporate it into our society. We hope there'll be a vaccination down the road here, which will help eliminate the virus. But our behaviors are still going to be key as to who and how many get the virus. For the businesses and entities out there, I ask that you continue to do good work with your spacing within your businesses and the way you conduct business. We know that you want to be successful. We want you to be successful. The questions that have come up tonight are very good questions. What do we do if we see a cluster? What happens if there's an activity that causes that outbreak? We'll deal with that on an individual basis. We'll deal with that on an entity basis. We'll deal with those folks. Well, what about enforcement? What happens if you have an entity or a place that just is causing all kinds of problems and not using the advisories, and people are getting sick left and right? We'll go in there and we'll deal with that. Just like we would if there was other health issues. We've had health regulations on the books for a very long time, not just in this state, but in this country, to protect people. We believe, and our numbers justify it, that working with individual Alaskans and working with entities, we have gotten to where we are today. You want to win the game by staying the course and working with Alaskans on an individual basis and entities. Will we see more cases? Yes, we've said this for months. It's the way this virus works. Will we see cases in places we haven't seen cases? Yes, most likely we will. Do we have the healthcare capacity to deal with it? We're confident we do now. Will we be increasing our testing? We will be. Let me ask a question. Dr. Zink, how many tests roughly have we administered so far? Is it 30-something? 34,000 tests. So we're ramping up our testing, which is going to help us track, identify, and track the virus. We have fishing opening now on the coast. We're going to watch that very carefully. Will there be incidences of the virus? Yes. But we're confident that we can control this spread with your help. So as we move through this, we're going to move from avoiding, and in some cases for folks, being afraid of, to understanding and respecting and managing. I think that's how we get out of this. There's going to be no declare victory. There's going to be no end. One day you stand up there and you stand in front of the flag and you say, it's all over. It'll be a situation where we look back over time and we say we've managed it, the vaccinations have come online, the antivirals, et cetera. But nonetheless, we have to take care of what we always said was going to be the secondary fallout from this, and that's society, the economy. There have been some distortions that have occurred as a result of our actions. In an effort to make sure that people don't get the virus, in an effort to make sure that we had the hospital capacity early on, a lot of folks did not visit their doctors or their healthcare practitioners. We want to make sure that doesn't cause problems. Where in avoiding the virus, we end up with folks that have heart issues and they're dealing with cancer and they're dealing with potentially kidney issues and high blood pressure and strokes and so forth. We've got to get balance back. And we're going to do that together. The virus is here. It's probably here to stay for a while. We're going to incorporate it. We're going to manage it. We're going to beat it with your help. Will there always be the outlying entity or individual that appears to behave in a certain manner not conducive to good health? Yes, we've always had that. There are people that choose not to wear seatbelts. It's their choice. There are people that choose to do other behaviors. It's life. Life is full of risks. But we're going to manage those risks. We're going to get through this. We're going to win this, as we said months ago. And we're going to come out stronger as Alaskans. So going forward, we're going to continue with the pressers. But we're also going to start to integrate more Facebook Lives. So, for example, we may have Commissioner Anderson do a Facebook Live so that questions can come to her from individuals and entities to talk about the CARES Act and how that's being distributed, how those programs will work. So folks, individuals can get those answers pretty quick. We'll probably have Commissioner Crum, certainly Dr. Zink, folks like Commissioner Ledbetter and others do the same thing. And we'll schedule those so you know when they're going to be. So we're going to up our information campaign and our understanding campaign of this virus so that every Alaskan has an opportunity to understand it and be able to deal with it on an individual basis. That's how we're going to win. That's how Americans behave. That's how Alaskans behave. And that's how we're going to beat this thing. So we'll get those schedules out. We'll start this process next week. We're going to continue doing what we're doing in terms of looking at our advisories, revising our advisories where needed. But I am confident, again, we're going to win this thing. And people are going to look back at this. And I think, I hope the history that's written on this is we dealt with this with the best available information that we had at the time. We constantly monitored that information, that data. We made decisions that protected the health of Alaskans, but we also made decisions to get our society and our economy back up off its knees. And I want to thank each and every one of you for that. And we're going to continue to work together and get through this.
Okay, so that was Governor Dunleavy's position at the end of last week on Friday afternoon going into the weekend. Now we'll bring things back home and hear what Mayor Copeland had to say at the city's 4 p.m. briefing on Friday. I would point out, actually, that this briefing went on longer than what we're going to share here because Mayor Copeland invited Kathy Renfelt from the chamber to discuss positioning the businesses to be successful as they start to open back up or increase capacity, particularly with this phase 2 reopening being a possibility, depending on how the council votes during the noon meeting. We covered a lot of this information with Kathy Renfelt already, so I'm not going to include it again here. If you want to hear that, it was, boy, I can't even remember from week to week now. Was it last Friday or the Friday before? One of our Friday shows, we spent considerable time with Kathy Renfelt, and if you look for the archive on the YouTube channel, you can find that. So for the sake of time, we'll share the rest of what Mayor Copeland had to say last Friday.
A lot has happened in the last 10 weeks, which is the length of this operation, the incident management team's response. But most of that has happened in the last 6 weeks. And we've had a lot of feedback from the public kind of asking, why weren't we doing more on the front end? And now we're kind of hearing a lot of questions about why are we having and keeping some of these restrictions in place on the business community. And I wanted to make a little more transparent to the community what's actually happened in those 6 weeks. Because what we were seeing at that time was that just about every single government, including ours, was responding to the coronavirus pandemic with too little, too late. And so our governor and our community took very quick action to put some very good travel protections and distancing protections in place, which fortunately we had learned from others was very effective. We put restrictions in place on businesses and so forth. We were under a lot of pressure as an incident management team, a city government, and city council to do that. And in fact, we were under a lot of pressure to do a lot more than we did. We also were expecting that there could be large outbreaks on the mainland and overwhelm the hospitals that frankly are a lot better situated to care for people with coronavirus. That would have forced cases to stay in Cordova, which would have further exacerbated the spread and likely resulted in some fatalities and more infection. So the team and leadership of the community and our state, frankly, took fairly quick and aggressive action. And I think in retrospect, all we can say that it was extremely effective. I think to date, we are the lowest, if not one of the lowest, if not the lowest infections of any state. And we are in a very enviable position of being able to start opening our businesses and travel and get a quote unquote return to normal much quicker than anybody had anticipated. We were talking about August just a week or two ago. So in the interim, several things have happened. We didn't have outbreaks on the mainland. The hospitals over there did have a small but steady caseload, so they did get familiar with treating the virus. They were able to test their training and facilities and so forth. But we know now that at least for the next few weeks, or unless something changes, that there's plenty of capacity on the mainland to handle the normal routine medical practices of the outlying communities like ours, which is when you have a case you can't handle, you medevac them. And we have lots of medevac capacity, and it's really the norm for our medical services in the state. So there's really nothing unusual with the situation we're in now. So that's a big change. Also, we just this week had the director of our state medical director for the state of Alaska, our chief medical officer, and also the chief medical officer for Homeland Security. And they have assured us in very specific detail what and how they can be available to help us if we get an unexpected surge at this time. We also have tremendous capacity for testing. We've been deploying that. Another 15 to 20 people, including myself, were tested today. I was visiting our facilities and so forth with people from out of state and out of town as part of this medical team that came on Wednesday. So we have lots of tests available. We've administered lots of tests. And the one kind of scare that we had with the active case at Ocean Beauty worked exactly how it was supposed to. An asymptomatic, all but undetectable case that could have caused spread was caught by the very protocols and planning that we put in place. So we're in a good place now. We're where we plan to be, although we had a lot of frustration and angst getting here. And we're very well positioned to be doing exactly what we're doing, which is trying to support our businesses and put them in a position where they can get back to work and do it safely, and then do what we can to support them. And as Dr. Sanders would say, don't forget to get out and get some exercise. So have a good one, Cordova.
Okay, that is a summary of Mayor Copeland's remarks from last Friday during the 4 p.m. briefing. If you want to see that entire briefing, by the way, I forgot to point out that it's archived on the city's YouTube channel and also on ours, youtube.com/Cordova TV. So if you want to hear everything that Kathy Renfeld had to say in that presentation, again, it's very similar to what she talked about in our talk show. So either one of those. Kathy and I were able to spend a little more time in the town meeting program for whatever Friday that was. I can't even remember now because they all mushed together. So again, that briefing, last Friday's 4 p.m. briefing, you can see on the city YouTube channel or ours, whatever is easier for you to find. And that brings us to today. Special city council meeting, May 18th at noon in the Cordova Center community rooms and via YouTube and teleconference. And in today's special meeting, the agenda has the latest COVID-19 incident report from the incident management team. There'll be the audience comment portion, which I expect they'll be doing using the telephonic system. When you're watching that on YouTube, you'll see the phone number that you're supposed to call. And then the new business item, the focus of the meeting will be the council ratifying or not, depending on the vote, Emergency Rule 17, which is part of that big emergency order, the local medical assessment portion, which would adopt recommendations of the incident management team, medical unit of medical directors, confirming implementation within the city, Phase 2 of the state Reopen Alaska Responsibly plan, and implementing Alaska Public Health Mandate 18, permitting intrastate travel to or from Cordova. So in other words, bringing Cordova in line with the state on a couple of key things. You might remember the state put out its decision that traveling between cities in the state probably doesn't need a 14-day quarantine anymore because there's very little community spread, and the case count has remained low, typically under 5 a day for the most part. So the state decided to not require 14-day quarantine if you're going, say, from Anchorage to Cordova or Homer to Fairbanks or whatever. Now, there is still the 14-day quarantine for anybody coming from out of state, whether that's another United state or another country, still 14 days of quarantine with all the associated restrictions. That was originally Mandate 10. If you want to refamiliarize yourself with the particulars, you go to the state site and it'll explain that. So Cordova, though, is going to come in line with the state on intrastate travel, and then also come in line to the state with regard to how the businesses operate, aligning with the state's Phase 2. And we'll talk, I'll actually run down the recommendation from the health team regarding the decision to move to that phase. Now, I want to point out, though, in case I forget later, that the state may be moving to Phase 3 at the end of this week, which would mean, if that happens, we would have 1 week here. Now, this is assuming the council agrees to go to Phase 2, which it seems likely they will, but, you never know. Anyway, so for this coming week, we would be in exactly the same position reopening the quote-unquote non-essential businesses as the rest of the state. But again, barring an uptick in cases, it's likely that the state is going to move to Phase 3, say, next Monday. But it's very likely that Cordova will remain at Phase 2. And the difference between those phases has mostly to do with the size of group gatherings and capacity for businesses to, say, have dine-in or total occupancy, what kinds of businesses can be open. So if you'd like to know more about that, the state website is a very good place to go right now, because we will be presuming now that this is implemented. At some point this week, we are likely to enter phase 2. And we are also, by the way, going to save all of the phase 2 documents so that when the state updates everything to phase 3, we'll call that, for the lack of a better term, say the 75% level, which is what phase 3 is mainly about. The state will be updating its website to all the phase 3 documents. We're going to keep copies of the phase 2 documents so you can still easily have access to those through our website if you're curious about what's allowed and what's not. But moving from phase 1 to phase 2 now does create some expanded changes for how the non-essential businesses operate. For example, restaurants, once phase 2 is implemented in Cordova, restaurants would be able to allow some walk-ins instead of everything having to be by reservation. Now, the restaurants, though, still would be required to log everybody that comes in case there's a COVID case, or even worse, a potential outbreak, because the contact tracing process is a lot easier and more precise. So expect that once dine-in is allowed at a local restaurant, expect to have to let them log your name, and I would assume there's some contact information or something in there. I don't know, because I don't have the attachment in front of me, but it's spelled out in the state attachments that are part of Mandate 16, the Phase 2 attachments. So expect to have your name and anybody that's in your party to have that written down. I don't remember if commingling of parties between different households is allowed in Phase 2. I'm inclined to think it isn't, but again, look at the documents to be sure. And here again is a situation where customers and restaurants, I mean, this would apply to any business, but we'll use the restaurants as an example. Customers and restaurants can help each other by having the right expectations before they do business together. So if you as a customer expect to have to let the restaurant log the fact that you were there, then you don't freak out about that. And at the same time, if you go to a restaurant for dine-in and they're not writing the names down, you can let them know, politely, of course, that the rule is that they're supposed to be writing everybody down, and be kind of like, hey, did you know you're supposed to be taking down my name and the other people? Because if you don't do that, you're going to, if you restaurant proprietor don't do that, you can potentially get in a lot of trouble. Because remember, violating these state mandates is big money. It's jail time. It's, I mean, worst case scenario, say that a restaurant was open, and this again would apply to any business. I'm not picking on restaurants. I'm just using that as an example. Say that a restaurant was allowing dine-in, but was not logging the people that are coming in, was not writing down all the names, and somebody ended up getting sick, or a sick person came into that restaurant and infected some other people, and a fatality resulted from that, that restaurant could be looking at $2.5 million in fines and up to 10 years in jail. And if there's not a fatality, it could still be a $500,000 fine and I think some jail time as well. So it's ugly. Not following these rules is not a road I'd want to go down. So again, this is a very good time to study. We're not in Phase 2 yet. It's not guaranteed that we will be. It depends on the vote of the council and then how long it takes to implement that after the council votes, should they vote in the affirmative. So this, again, would be an excellent time, like I said, for all of our proprietors to take a look at these documents. And there are some more types of businesses that are going to be allowed to open under Phase 2. Bars are in there at 25% capacity. The capacity for the businesses that have been allowed to be open already goes up to 50 in most cases. So it does expand things, but we believe, everybody's going to have their own opinion about this, but we believe that it's really good for customers and proprietors to look at these documents. So right now, if you want to study for the potential advancement of Phase 2, go to the state's website, covid19.alaska.gov, I believe, and look at Mandate 16. And under Mandate 16, you will see links to all the attachments for the different types of businesses. Now, as for the opinion of our medical folks, Dr. Sanders, Dr. Blackadar, Dr. Rush, and two other doctors whose names I should know how to pronounce, but I don't. We'll call them Dr. Adam and Dr. Brian, because I don't want to butcher names. They sent a memo to council titled Cordova's Medical Unit Medical Directors Recommendations to Council Regarding Phase 1 and Phase 2 of the state's Reopen Alaska Responsibly Plan. It says, Dear Council members, upon careful review of the State of Alaska public health mandates and the Reopen Alaska Plan Phase 2, Cordova's Medical Unit Directors, or the Cordova Medical Team, recommend the following actions by the city. Implementing Public Health Mandate 18 on intrastate travel. That's the one that allows it without quarantine between cities in Alaska. And then implementation of Phase 2 of the state plan under Mandate 16. The medical team goes on to say, while we feel the state plan is well thought out, the key will be in enforcement and a low threshold to back off the plan if cases exceed the ability to treat patients and track contacts. Our recommendation is to have a clear plan from the city on monitoring and enforcing the restrictions detailed in the city's plan. This must be implemented in order to be able to continue safely following the state's plan for reopening. After Cordova's first case, the city has not yet had another, which suggests social distancing and business operation restrictions are effective. Consequently, the Cordova medical team is growing more confident in Cordova's ability to respond to an increase in COVID-19 cases in the upcoming weeks and months. The city's preparedness to respond to COVID-19 justifies lifting restrictions as recommended above. Further, the Cordova medical team recommends implementing the intrastate travel guidelines enacted through the State of Alaska Public Health Mandate 18. Currently, the city does not anticipate a large influx of visitors arriving by airplane outside of visitors qualifying as essential workers or traveling for subsistence purposes like fishing, hunting, or family care. Given that these visitors are currently permitted to travel into the city, Mandate 18 will not have a significant impact on Cordova's population until the arrival of the first ferry, which is not scheduled till early July. This window gives us the opportunity to assess and revise the team's recommendations regarding implementation of Mandate 18 if the influx of intrastate travelers permitted by that mandate presents a health risk to Cordova. So in conclusion, they say, for all the reasons stated above, the Cordova medical team respectfully requests Council adopt the recommendations included above. The undersigned will be available to answer Council questions and address concerns at the Council meeting addressing the recommendations in this letter. And again, the 5 doctors have all signed that. So again, the doctors are signing off on intrastate travel for the time being. And of course, they will always make recommendations to roll things back if stuff goes badly. So there again, that's all the more reason for anybody that would like to see the city continue to move forward with, say, business reopenings. The best way to make sure that that continues to move forward instead of having to be pulled back is to help each other as businesses and customers to follow all of these rules that are laid out in the state mandates. Because if we do that with the masks, with the logging of customers, staying at the proper capacity, customers not pressuring businesses to not follow the rules because they don't want to have to. I don't want to wear a mask. Let me in anyway. No, that's a bad idea. Business owners not thinking, these rules are dumb. I'm going to let people in without masks, or I'm not going to write everybody's name down. Also a bad idea. Because if we blow it, we not only risk having the authorities have to pull back to one of these previous levels that's more restrictive, but we also risk making each other sick and defeating the whole purpose of the gradual reopening and trying to find this increasing point of compromise based on the data. So again, what's on the agenda, the resolution that's on the agenda, looks to pass a couple of things. The first one is this local medical assessment provision, and we'll just run this down here. It says, except as otherwise provided or prohibited by law, any revision or repeal of all or part of a state of Alaska health mandate shall be reviewed by the Incident Management Team Medical Unit of Medical Directors and approved by council before becoming effective in the city. The Incident Management Team shall submit its recommendation to council no more than 10 days after the revision or repeal is posted on the State of Alaska website. In the event council does not take action under this rule within 10 days, the revision or repeal adopted by the state shall become effective. The Incident Management Team shall notify the public of a delayed effective date by posting notice on the city website and broadcasting notice on a local radio station. This rule shall apply to state revisions and repeals issued on or after May 7th. So in other words, what the council is saying is that when the state changes one of its mandates or puts in a new one or something, they want a local review by our best experts, namely our medical team, and for their recommendation to either move forward or not move forward to be brought to council. If the incident management team doesn't think that Cordova should do something different than the state, then they can either just not respond within the 10 days, or they could, I would think they could go ahead and say to council, we've looked over this, we think it's fine to stay in sync with the state. And again, if you want to read this and digest it yourself, it's part of the packet for today's meeting, which you can find on the city website. So that's the first thing they're doing, is formally inserting the incident management team's medical unit of medical doctors into the decision-making process. And then the other part in the resolution, Section 2, would be to adopt the recommendations of the medical team and move Cordova into compliance with State Mandate 16 Phase 2. That's what I like to call the 50% level. We're at the 25% level now in Phase 1. This would move us to Phase 2. Now, again, don't let my nickname throw you, because not every business gets to operate at 50% on this. Maybe I shouldn't give things nicknames, because the 50% is an expansion for businesses that are already open. And then there are some new businesses, like we said, bars I think are included in there, being able to open at 25%, if memory serves. So the city is voting on implementing Phase 2 of Mandate 16, and then also formally acknowledging the state's Mandate 18 on intrastate travel, city to city within Alaska, which the medical team has also signed off on for the time being, with the provision that they are going to evaluate that again once the ferries start coming in and see. You're listening to the Town Meeting Program for May 18th. And another very interesting piece of news came out. When was that? Friday last week? Is that the 15th? And this is something I have a feeling that a number of you who enjoy the companionship of others will be glad to hear. The headline of this news release is, "As restrictions ease, Alaskans may choose to slightly expand their social circle to strengthen support networks while still preventing the spread of COVID-19." And here's what it says. As Alaska slowly reopens its economy and eases restrictions, some Alaskans are wondering how much socializing is reasonable if we hope to continue to prevent the spread of COVID-19. In Phase 2 of the Reopen Alaska Responsibly plan, gatherings of fewer than 50 people are allowed as long as non-household members remain at least 6 feet apart. But what about having dinner with one other household at your home, watching your friends' children, or allowing your children to play with their cousins or the children of your closest friend? What level of social interaction is currently considered safe? Alaska's Chief Medical Officer, Dr. Zink, says the answer to those questions may vary from household to household and will depend on the risk factors of everyone living in them. Generally, and according to the state's mandates, Alaskans are expected to keep at least 6 feet from all non-household members. However, in some cases, if a stronger support network is needed, Alaskans may begin to expand their social circle to include just a few others. As we begin to socialize more, Zink said it may be helpful for Alaskans to consider a concept called an expanded social bubble, which is already in use in New Zealand and some Canadian provinces. The idea behind this concept is that a household may choose to expand slightly to link with one other individual, couple, or household if it's deemed mutually beneficial and agreeable to everyone involved. Zink said, quote, this is something that other countries and communities are trying out as a way of providing added social support while continuing to limit most social interactions," end quote. Once linked through this process, the individuals with an expanded social bubble can visit each other's homes, share meals, care for one another, help with home projects, or go on recreational outings together. Children within that enlarged bubble may play with each other in close proximity, indoors or outdoors. Outside of that trusted bubble, all household members still must keep at least 6 feet apart from non-household members. Another important point is that once a household has expanded its bubble to include others, the members within that bubble need to remain consistent. You should not choose to include 2 new members one week and then substitute one of those members for someone else the following week. Zink said, quote, "Consistency is key. Expanding your bubble, even to include just 1 or 2 others, is not something to be done lightly. Alaskans have done a tremendous job since late March preventing the spread of COVID-19 by limiting their social interactions. That needs to continue, but we recognize that if people have more social support, limiting other social interactions will be easier to maintain as COVID-19 continues to be of concern in our communities," end quote. Joining with another household, or just 1 or 2 individuals, allows parents and caregivers to take turns caring for children, provides children with more opportunities to play and socialize with other children, and will help ease loneliness and provide improved social support for those who have felt isolated. Mike Abbott, Chief Executive Officer with Alaska Mental Health Trust Authority, says he expects this model could prove beneficial to the mental health of Alaskans. Abbott said, quote, "Alaskans are showing considerable resilience under extremely difficult circumstances, but this adjustment, done correctly, could represent a great way to relieve stress and anxiety for Alaskans who have been feeling alone or isolated. It provides Alaskans with options to help build a stronger network of support," end quote. If Alaskans choose to expand their social bubble, they'll first need to consider their risk for serious illness from COVID-19. Those most at risk, such as those 65 or older, or people with an ongoing health condition, will need to be the most restrictive, keeping their bubbles as tight as possible to prevent spreading infection into the group. The larger the group, the more socialization can occur, but that comes with added risk. If one person in the group becomes sick, that person will need to be isolated from the remainder of the household, and anyone else who is not ill will need to remain quarantined, assuming close contacts occurred with the sick individual. Dr. Zink is urging Alaskans to voluntarily keep track of their social interactions. An explanation of the bubble concept and a sample tracking worksheet are available on the state's website, covid19.alaska.gov. And for a more detailed explanation of this concept, Dr. Zink has a blog called Play Every Day that you can visit and look for the episode that has a question and answer with her on this idea. So that's the end of the news release, and there's some very interesting stuff in there. I looked at the worksheet, and it, is by no means, it's not like the state is saying you must download this and you must fill this out and so forth. It's just a tool that you can use to implement this maybe in your life without having to invent the concept. A good way to implement it has already been laid out, and if you go again and find this document, then you can see what's going on. And of course, there's absolutely no requirement that anybody do that. And you shouldn't allow yourself to feel pressured. If you've got, say you've got a friend who's really been wanting to get together, but you don't feel safe quite doing that yet, don't let yourself be pressured by someone to say, oh, come on, it's okay. Dr. Zink said, it's all right. So we need to get our kids together. If you don't feel that that's safe, continue to maintain your boundaries. But if you have been needing that, and you know other people who have been needing that, then a very cautious, measured, thought-out approach has been laid out there by Dr. Zink and the other folks at the state level in making this recommendation. The key thing, though, really, I think, just my opinion, is anybody who's in a household that has a person at higher risk, whether they're elderly or with an underlying condition, should be real cautious, obviously, because it is a calculated risk. But we wanted you to know that the idea was out there, and so you can take or leave it as you see fit. You might be interested to know, I don't think I'm going to take the time to read the whole thing, but there was a news release about a positive case in Dillingham, similar to the positive case that we had, where they found an out-of-state individual who had recently arrived in Dillingham to work for Trident. And the thrust of it is that the Trident plan to catch and isolate cases worked again. Just briefly here, the case was discovered when several workers quarantining in the same location were tested at the end of their 14-day quarantine. Before workers can be released from quarantine, they have to meet all the requirements outlined in the City of Dillingham ordinance, including test requirements. Only one worker in the group tested positive. That person was immediately isolated from the others. Trident is arranging transportation for the worker to leave Dillingham. That's probably happened already. So that's what Trident said that they were going to do. If they had a positive case, they're just going to ship that person out and not try and quarantine them locally. But everybody in that group who might have had contact is doing another 14-day quarantine. Even though they all tested negative, they still have to do a 14-day quarantine. So it does seem, at least so far, like these processor plans are working. And one final note as we wrap up here, I got a note from Molly Mulvaney that the city, it was a reminder that the city has hired people to continue the airport program and expand. This is the ambassador program for the airport and in the harbor. So the volunteers, they don't need to recruit volunteers anymore. But I want to tip my hat to those 15 or so people that donated a lot of time and a lot of gas for a month on their own initiative to go out there and greet people coming in, to give them the paperwork and make sure they knew the city's rules. And I mean, who knows how much chaos, in terms of case count, was prevented by those folks going out there on their own initiative. I mean, that's Cordova. And there were other volunteers that kept bringing masks, and not only to, protect the volunteers, but also to give away to people coming into town. And another volunteer who worked to keep the volunteer group up to date on the mandates, so they were always giving out the most current information and keep the message consistent and all of that. I mean, what a great thing. Because it took a while for everything to line up, for that to be done officially. And, these people just said, I see a serious need, and I'm going to gather some people up, and we're going to go take care of it. I know Alyssa Kleisler was one of the first ones I saw a picture of out there. I don't know if she was the first person to do it, and the city took notice of that excellent volunteer effort and incorporated it into the plan, and there you go. Now, that doesn't mean, of course, that the city is going to incorporate dumb ideas like that video shaming incident that I saw occurring at one of our local businesses, and I couldn't even tell if the crazy person was an employee or just another person that was just a shopper in there or what the heck. But, I mean, this has definitely brought out the weird in some people. So I don't expect authorized vigilante squads or anything like that, but these good ideas that have been shared, some of these volunteer efforts that are now part of the city's official plan, I mean, way to go. So we'll bring it to a close here for today, our town meeting program for the 18th. If you missed any of it, want to hear it again, or want to share it with somebody, you can do that by giving them a link or utilizing a link to this program once it's uploaded to our YouTube channel, youtube.com/Cordova TV. You'll want to look for the town meeting program for May 18th, the one that has all the red letters. We'll have our daily briefings later today in the 1 p.m., 5 p.m., and 8 p.m. hours. Those get archived on the YouTube channel as well. The council's special meeting starts at noon. It'll be live on the city's YouTube channel, then later archived on their channel and ours. I think we use red and blue letters for daily briefings and red and yellow letters for special council meetings. We try to make them look a little different so they sort of stand out from each other. So again, that YouTube channel, youtube.com/Cordova TV, that's our repository for all of our COVID content. Very huge, big, gigantic thanks once again to Cordova Wireless Communications for their sponsorship of your local talk show. They serve as your local cell phone provider, and particularly in pandemic times, that very important practice of keeping local dollars here when you are a client of theirs, using them for cell phones, wireless data. That money that you spend with them is recirculating through our town, in addition to all that outside money that they bring in. It really is a remarkable operation, and their support matters a lot to us. So thank you for listening. Any of our regular 10 a.m. features that were supposed to be here will be. We'll just line them all up, play them out for you. Hope everybody continues to be safe, keep that case count low, and thanks again for joining us for the Town Meeting Talk Show.